My name is Maureen Caro, although most of my patients call me Mo. I'm a family nurse practitioner and I've been with Health Partnership Clinic since 2019. So I'm here talking with you guys today to talk about a subject that's very near and dear to my heart, which is HIV care and prevention. So HIV and AIDS are not the same thing, although they are related. HIV stands for Human Immunodeficiency Virus, which is a virus that once a person is infected and left untreated will go on to develop the disease called AIDS, which is acquired immunodeficiency syndrome. The riskiest activities for becoming infected with HIV are obviously blood transfusion is on the top of the list. We very much test very thoroughly all of our blood supply now. This is older information going back to the beginning of the epidemic. After that, the highest risk is sharing needles for IV injection drug use. And then after that, it's receptive anal intercourse. So as to the risk of becoming infected with HIV from oral sex, the risk is very low. However, if there is any open lesions in the mouth, then the risk does increase. There are other infections you can get from oral sex, so I do always recommend using a barrier method, such as a condom or a dental dam. So typically, for the time from HIV exposure to the time of having symptoms of active HIV infection is about 2 to 4 weeks. We do have new and improved testing. So that way, if you do have any concerns, please come in to Health Partnership Clinic or to your primary care provider to discuss it and become tested. A common question that I'll get from my patients is, do HIV symptoms differ? Are they different from women and in men? The answer is no. They're basically the same. Common symptoms of that primary HIV infection is kind of your typical viral symptoms: fever, swollen lymph nodes, sore throat, fatigue. Occasionally there is a rash. If you do have any concerns, please call your primary care provider and make an appointment to get tested. The exciting thing about the field of HIV care is that I have seen in my lifetime huge changes go in HIV care. It has really gone from being an untreatable disease to something that's very manageable, the same like diabetes or high blood pressure. There are a lot of different types of medication on the market right now. The most exciting thing is there actually is also medication to prevent HIV infection if you do have risk factors for becoming infected with HIV. You can start medication immediately as soon as you learn of your HIV diagnosis. Many clinics will actually have the medication there, so you can take the first pill while you're in the office. So something I'm very excited about is PrEP, which stands for pre-exposure prophylaxis. If you have any risk factors for developing HIV infection, such as sex work, if you have an HIV infected partner, you can take a low dose of the antiviral medication to help keep from developing the infection. The nice thing about this is that it does not lead to viral resistance. And it's really exciting, and any case of HIV that I can prevent is always going to be a good thing. Here at Health Partnership Clinic, we are open to everyone. If you do have any questions and you'd like to establish a relationship with one of our providers and have your care here, would you please call us 913-648-2266 and make an appointment.